Hello everyone and welcome to Inside Healthcare. In this program we'll tell you about an exciting new weight loss program that's resulting in a 97.7% weight loss. We'll tell you why it might be just what your doctor ordered. We'll also tell you about one of the most common complications following surgery. Find out if you're at risk for it. But first, let's talk about spring allergies. And we're very pleased to have back with us Dr. Stephanie Fox, a HealthEast allergist. Thanks for being with us.
Thank you for having me.
So it looks like the snow may be gone now finally, but it could be coming back. What are you seeing in the offices so far with spring allergies?
Well, we finally have seen tree pollen show up in our community, so starting to see a lot of people with their springtime allergies, seeing a little bit of some active asthma, so patients having difficulty with their asthma as well. But with the pollen in the air expected to get worse, probably you're going to see more of that.
So what kinds of, how does the weather impact what you are seeing?
So the quicker it warms up, the faster we'll see tree pollen. If it were to stay kind of damp and on the colder side, then we'd see more mold in the air. So it just depends on what the weather does. But with the amount of snow that we've had this year, it's good hydration for the trees, so we expect that we'll see a very high tree pollen season.
And then how does someone know, like I'm having little watery eyes as we talk here, so how do we know if what I have is an allergy or is it a cold? And then how does that differ on how I should treat it then?
So that's a very good question, and it is difficult to tell the difference between the two. But often colds will resolve in about 7 to 10 days, but allergies will take quite a bit longer to resolve. They'll usually persist through the season if they're a seasonal allergy type person. Usually the person will notice too if they've been outside for a whole day, for example, and they have a pollen allergy, that they'll be worse the next day. Oftentimes colds will kind of stay the same for that 7 to 10 days as they resolve. Sometimes too if people have fevers or body aches, those things are more infection related rather than allergy. So they are kind of similar, but it mostly depends on the timeline.
And what about treatment? How does that differ?
So treatment for colds are supportive care, so hydration, rest, sometimes some over-the-counter decongestants if needed. But for allergies, things like antihistamines or nasal sprays are what are indicated to help improve their symptoms.
So is this something I could just take and then hopefully the symptoms would go away then, or?
For the allergies? Mm-hmm. For the allergies, yeah, I mean, treating with a regular antihistamine over the counter is very reasonable to try and suppress your symptoms. If that doesn't work, it may be that it's more a cold, or maybe you're having breakthrough symptoms because you have more severe allergies, and that's probably when you need to see a physician.
And what do you advise for your patients on what type of over-the-counter versus prescription medication?
So most patients can treat with things over the counter. Almost all the antihistamines are over the counter. So things like Zyrtec, Claritin, Allegra. They're very available at all of the local retail stores, so you can get those. And there actually is a nasal spray that just was approved to go over the counter. That's a steroid nasal spray. Previously, that was a prescription, but now it's an over-the-counter medication. It's called Nasacort. And oftentimes, patients will find most effective for their symptoms is to treat with an antihistamine, plus using that steroid nasal spray.
So when would you add the nasal sprays, depending on your symptoms?
Depending on your symptoms. So nasal sprays work better for congestion, where antihistamines work better for itchy, irritated symptoms. So if you have a lot of congestion and not as much itchy, irritated symptoms, the nasal spray will probably be more effective for you.
And then when should someone come see a specialist versus just going to the family doctor or just self-treating?
Sure. So patients with asthma, if you're on a preventative medication, meaning a daily inhaler for your asthma, all of those patients at least sometime in their life should have allergy testing of some sort. So that would be important to discuss with your physician. If you have allergy symptoms that are not controlled with the regular antihistamine or even the nasal spray combination, you should also see your doctor to discuss what other therapies might be available for you.
And does someone need a referral to come see a specialist like yourself?
Not usually. Most insurance plans don't require referrals now, but you should check with your insurance company just to check.
And you have offices at multiple locations?
HealthEast Allergy is at Woodbury, Maplewood, and Midway locations. And
so again, they can come see you for any of those things. Mm-hmm. So what's on the horizon? Like you said, the trees are starting to get some blossoms. What else?
So trees pollinate in the spring, so we see mostly tree pollen during the springtime. Come June and July, we'll see grass pollen. And then come August through October, that's when we see weed pollen, so things like ragweed. And molds can be kind of throughout the year, but they tend to be more in the late summer, fall.
So that's probably what we're seeing a lot more right now is the mold, as that snow is melting. And
yeah, we would see the molds. Molds need about 35 to 42 degrees in order to thrive. So if it gets warmer than that, then they're not really present in the environment. And they're difficult to measure because it does change almost hourly depending on what the weather is. So dry, windy days are better for pollen. Wet, moist days are better for mold.
And it sounds like the forecast for tomorrow in the mid-70s with a lot of wind. So that means...
Good pollen. Good tree pollen day for tomorrow, so be prepared for tomorrow.
Anything else that people should know about allergies and asthma?
So it's important never to be miserable. We have great therapies and medications. It's one of my pet peeves when I hear people say, oh, my springtime allergies are horrible. We have great therapies. We have great medications available, so never think that you have to be miserable. And that's probably the most important thing that I'd like to get out there.
Any final comments about spring allergies?
I think the most important thing is just be prepared. Using medication ahead of the time is most effective. If you use it kind of after you have symptoms, sometimes the symptoms don't resolve as quick as you would want them to be.
Are there other things that you could be doing, like keeping windows closed? Though at this time of year, I want to keep them open as much as I can.
That is difficult, but on those dry, windy days would be an important time to keep the windows shut. Taking showers before you go to bed is important, so get all that pollen off of you that you've been outside with during the day. And then you can use simple things like saline rinses for your nose that you can get at most of the retail stores. And it's just a saline wash of your nose. You know, you wash your hair and clothes. Why would you not wash your nose? That has all that good stuff in there.
I wouldn't even think to wash my nose.
Yeah, so you're decreasing your exposure, basically.
All right. And if someone wants to get a hold of you and get more information, how do they go about doing that?
So our phone number at HealthEast Allergy is 651-326-1044. We also are listed on the HealthEast website.
Well, Dr. Stephanie Fox, it's always great to have you with us. Great information as always. Thank you.
Thank you.
And